Hello, this is Cathy Ripmaster. I'm a physical therapist at Lincoln Developmental Center. And today I'm going to talk to you about the Rifton Pacer and how to make some adjustments. So one of the common problems that I see with the Rifton Pacer is that when students are in it that I work with, that a lot of times the chest prompt is too high, which can cause problems by putting pressure on your axilla and the nerves and the blood vessels that are in your armpit. And it can cause numbness and tingling of their hands. It could cause their hands to turn red or a purplish color. And it's just very uncomfortable for the student and not good long-term for them with that pressure there. And it also limits their ability to move themselves in the pacer. So one of the first things that I do is look at the pacer frame height versus the height of the seat, and today using the hip positioner in the pad. So the first thing that I see is that the seat is too low based on the height of the frame. I actually have this frame all the way up as high as it can go. And you might think, why isn't my student able to stand? So the arm prompts are up so you can see a little bit better. But my chest, or my hip positioner, is attached to this front bar in the front, right here. And my L bar, the handle, is beyond the frame, so it's back here. So when I'm in here with a position like this, I'm getting a lot of pressure in the front. So one thing that I can do is just trying to adjust the height of the seat and raising that up. That will get me high on the chest prompt. I'm still kind of in a little bit of knee flexion, so I might want to get that seat higher. And you might think, man, that seat is so high and tight on them. But actually, I find that for me, it's a little bit more comfortable when the seat is higher because it's putting more pressure on my buttocks. And also it gets me off my armpits, so I'm higher on the frame and it's a lot more comfortable and easier to stand and bear weight. One way that I do adjust it if I have a student that's a little bit larger is that I might lower the frame so that I can sit underneath them and raise them up with my knee and then raise the seat. I can just raise the seat with them in it, or maybe even put my knee under them while I'm standing and raise them up a little bit to take some pressure off and move it around. If I move the front of the front strap from behind that lateral bar that it was hooked to and attach it in front of the chest prompt, that can also change the angle of the seat for me. But you need to adjust sometimes the location of the chest prompt so it's far enough back that there's space for that to clip in. I personally think that's more comfortable, having it here. You can also have it attached at the chest prompt, and what that does is it changes the angle. So for me personally, I find that if my seat is flat, it's more comfortable, but depending on how the student or the individual that you're working with, how their pelvis is positioned just naturally, they might need their backside lifted up a little bit higher. Maybe they need the front angled a little bit. The best way for you to figure this out is if you are in a pacer yourself and you can play around with it based on how they look and the position of their pelvis. So you get into the pacer, feel what it feels like, and then get your individual into the pacer, and now then you'll know how it feels and how you can adjust it in order for them to be the most comfortable and most functional. I hope this was helpful for you today, and please check out some more of the videos that I've made. Take care. Thank you.